According to a new survey by the American Psychological Association, burnout, depression, and anxiety are among the top reasons more people are looking for help from mental health professionals here in the United States, and Texas is no exception. We're joined now by Dr. Alfonso Mercado, a psychologist and associate professor at the University of Texas, Rio Grande Valley. Thanks for taking the time this afternoon.
Thank you for the invite.
Let's start with this. Are more people struggling with mental health issues, or is it just that more people are now looking for professional help?
Absolutely. Mental health has been another pandemic that not a lot of attention has been given to. Yes, we are going through a COVID-19 pandemic, but we're going through multiple pandemics, and one of them is that of mental health. The pandemic has exacerbated symptoms of depression, anxiety, and has also triggered mental health symptoms. And this is very concerning because of the lack of mental health resources in some communities in our Lone Star State.
You mentioned access to care, which is a really important topic. According to the American Psychological Association, we are facing a crisis when it comes to mental health now. How bad is it?
Absolutely. We are definitely going through a mental health crisis. Another pandemic, as I mentioned earlier. Unfortunately, the state of Texas, we rank last in mental health funding for different programming in our communities. A lot of underserved areas, rural areas in the state of Texas have been affected tremendously. And there's a long wait list. Many of my colleagues in the field, psychologists, social workers, therapists, counselors, they have a wait list. Community mental health clinics have a wait list because of this dire need that we're currently living.
We talked earlier about more and more people trying to get care. How does a person know when it's time for them to seek help, mental help?
That is a great question. Once the depression symptoms, the anxiety symptoms start affecting your day-to-day living, when you're unable to sleep, unable to eat properly, when the symptoms start affecting your personal relationships, your productivity at work, that is very concerning. Treatment is available and treatment works.
Finally, there might be somebody watching this right now that says, maybe it's time for me to seek help. And some people might not know what to do. They might not have any idea where to go or what to do. What would your advice be to someone like that?
I think what's very important is to see what kind of support system that person has. Family members, friends or peer groups, resorting to that social circle is so important right now. Also looking at the availability of treatment programs in the community. Even though there is a wait list with many clinics, contacting the local community mental health centers, local, crisis centers too that are available 24 hours a day, knowing where to call and who to call is very important.
It's a very important topic, a very important conversation. I'm glad we're having it. I'm glad we're having it with you, Dr. Alfonso Mercado. Thank you so much for your time this afternoon.
Thank you.
Lots of great information, and if you or someone you know needs help, you can use the 988 Suicide and Crisis Lifeline. Anyone who calls or texts 988 will be connected to trained counselors who can provide support and connect callers with resources.